My name is Dr. Joseph Valenti, and I'm originally from Buffalo, New York, and have worked and lived in Denton since 1998. I'm the founding member and founding partner of Caring for Women, an OBGYN practice specializing in minimally invasive GYN surgery and pelvic reconstruction, as well as treatment of incontinence. I'm a nationally recognized Da Vinci robotic surgery proctor, and I've performed over 300 robotic Da Vinci cases. My bowels are sluggish. What do you recommend? This is one of the most common questions we get after surgery. Of course, general anesthesia, which is often used during surgery, can make the bowels sluggish, as can the use of post-operative pain medicines like narcotics. We recommend to the patient that they wean off narcotics as quickly as they can, and perhaps begin to use things like nonsteroidals such as ibuprofen or naproxen, as well as Tylenol, in place of narcotics to help get the bowels moving. We also recommend plenty of activity, as much as can be tolerated and is safe post-operatively. That means getting up and moving and walking and not laying around at home. Oftentimes, a stool softener may be needed, as constipation can even be a source of pain after surgery. Immediately post-operatively and later on, chewing gum can be a sign to your colon that you're actually going to be eating something therein that helps the bowels get moving as well. All these approaches can get you moving quicker and result in less discomfort abdominally. I'm not in pain, but I'm having trouble sleeping. How do I handle my post-operative insomnia? If you're having trouble sleeping after surgery, this could be caused by a number of things. The first is surgically induced menopause, i.e. removal of the ovaries, meaning an automatically induced menopausal state. Or these may be normal post-operative changes. Sleeping habits at night post-operatively are quite important, and one must recognize that a healthy habit, i.e. allowing the brain to get ready for sleep, with low stimulation, no computer, no television, and perhaps reading a book is all that's needed. Sometimes patients may require Benadryl. Of course, prescription drugs like Ambien and Lunesta are used as a last resort. If menopausal changes are responsible for insomnia, then a patient should discuss with their surgeon whether or not hormone replacement in the form of something natural or something prescription may be in order to help with menopausally induced insomnia issues. Will I spot and bleed for a long time after my hysterectomy? After hysterectomy, patients may have no bleeding or some spotting, which may last up to 6 weeks or longer. The area at the top of the vagina, known as the vaginal apex, is where the edges of the vagina are brought together, where the cervix was. This area is where granulation tissue, i.e. new growth tissue, is formed, and that area is very friable, meaning it bleeds quite easily, and this is often what leads to the spotting after hysterectomy. This spotting, again, may last up to 6 weeks or longer, or not be present at all. At the 2-week and 6-week visit post-operatively, which is when we see patients, this is an area we sometimes examine, and if that area needs to be cauterized to get rid of the bleeding, that will be done. Premature coitus after hysterectomy can also lead to bleeding, and we ask patients usually to remain on pelvic rest for 6 to 8 weeks after hysterectomy to prevent this post-operative complication. When can I go back to work? A patient's return to work will depend largely upon what kind of work they do. If you are involved in a job that involves a lot of heavy lifting or straining, then you may have to wait 6 weeks. Conversely, people who do desk work or may have lighter jobs may return to work in 1 to 2 weeks, again depending on whether or not they've had a minimally invasive procedure. We usually tell patients that we'd prefer that they do not strain, but some lifting is okay, and I usually counsel my patients that 20 to 25 pounds is about the maximum for the first 6 weeks. If they are doing desk work, sometimes our patients are immediately back to work at home on the computer. People who may be lifting patients or lifting something heavy may require a full 6 weeks or more. My incisions sting and hurt. Is this normal? Of course, some incisional pain after surgery is normal, but this should taper off relatively quickly. In our office, we generally close wounds with a stitch beneath the skin that will dissolve, so there'll be nothing to take out. If the stitch is draining or pussy or red, then there may be a slight infection which might need to be monitored and or treated. Usually, we have the patient leave the wounds covered for 48 hours, and then they can be open to the air. Basic wound care like soap and water, antibiotic ointments, and anti-scarring meds may be used to help those incisions improve. Of course, proper nutrition and protein is needed for wounds to heal, as any wound will eat up about 60 grams of protein a day. So nutrition is an often overlooked part of wound healing, but very important for proper care. Any signs of fever, infection, pus, or drainage should notify you to call your doctor to have them look at your wounds, but generally they will be examined at your 2-week and 6-week visit postoperatively, and we can expect the healing to occur over that period of time, and the pain should taper off very quickly after surgery. Should I douche following my hysterectomy? We do not recommend douching after hysterectomy, or in fact any time. Douching flushes out the good bacteria, which are known as the lactobacilli. They're the bacteria that make the vagina acidic and keep the bad bacteria, also known as the anaerobic bacteria, at bay, and this is what prevents infection. In fact, douching can lead to infection by flushing out the good bacteria. As the top of the vagina is healing, the vaginal apex, where the stitches are, may sometimes produce a greenish or yellowish discharge, which may be confused as an infection or a bacterial vaginosis, when in fact this is just stitch that is hydrolyzing or dissolving. In any case, if an infection is present, known as a cuff cellulitis, which is one of the most common postoperative hysterectomy complications, it can be treated with an antibiotic. In any case, we do recommend vaginal rest for at least 6 to 8 weeks after hysterectomy.